My name is Alyssa McBride, and my journal article review was done on the article I found on the retrieval of long-term memory in patients with brain injuries. This journal was done by Angelica I.T. Thone, Stefan Zizet, and D. Eves von Kremon. The article came from the Journal of Clinical and Experimental Neuropsychology, and there was a lot of good information there. First, it spoke to the participants. They began with 18. They did lose a few due to those patients being unable to learn the sets to begin with. So they ended up with 13 participants that had brain injuries with memory impairment. That did include both male, female. Their education years ranged from 8th grade to 12th grade. There were different diagnoses of the brain injuries, whether it be a traumatic brain injury, HSE, an aneurysm, carbon monoxide poisoning. There were some differences there, along with the time since the lesion formed. That was quite, there was a lot of difference there. It went from 4 months all the way up to 109 months from the injury. So that's something I'll mention a little bit later that could be, the data could be stronger there if they had a little bit more of a tight-knit memory impairment group. They, of course, went against the 13 healthy control subjects, and the method that they used was they taught the patients sets of 2, 4, and 6. They gave them a day to learn these sets, and then the following day they used two different methods to try and retrieve those memories of the sets. They found within those sets, the 2 and 4 sets, there was almost no difference between the control study and the memory impaired brain injury subjects. They were questioning whether it was just an automatic response at that point, or if there was actual retrieval happening there for them to be able to correlate to the study. As the set size got larger, the 6th, the harder it became, of course, for the brain injury participants, and they did start to wonder as well severity of brain injury and whether or not these were true statistics based on not knowing their recollection status to begin with was kind of difficult to go on there. There were some weaknesses in the study. It was a small sample to study from, which I think a lot of times is always mentioned as obviously the smaller the participant size, the less broad of a view that we have about it. Again, they did not test for the severity of brain injury nor the ability to recollect, really, other than that, just like learning the 2 to 4 sets. And they, again, that seemed like it was more of an automated response rather than an actual recollection of the memory. A lot more testing has been done on the short term versus the long term. So the researchers are wondering if the same tests are actually adequate for the long term that they're using. As I mentioned previously, there was also a large difference in time since the brain incident occurred. And then another thing that I questioned was there was no reference to like rehabilitation status, whether or not those participants have been receiving long-term care, have they been working on their memory, have they, been in a facility that helps them with long-term memory retrieval or any kind of memory retrieval, or have they just kind of been left with their brain injury and it is what it is. That would be an important thing to know, I think, while trying to grasp this knowledge of the retrieval of the memories. Also, as we know, depending on, the education level, 8th grade and 12th grade, there's kind of a big difference there as far as learning. And the way that they were trained, it didn't really go into that on when they were learning those sets, if they were learned in a way that was going to set the participants up for success to actually retrieve those memories. And again, it's dependent on the severity, if they even have the ability to retain that information.